37-year-old man presents to urgent care clinic with complaint of speech problem and yellowing of eyes. He admits using intravenous drugs. His vital signs are kind of normal. On physical examination, he is jaundiced and his speech is slurred. Plaques are visible on lower leg and in oral mucosa. His liver enzymes and viral markers are shown. AST and ALT are raised. HBs antigen and antibody both are negative. Anti-HCV antibody is positive and RNA is also positive. A biopsy of skin would most likely show which of the following: microabscess with fibrin and neutrophil, lymphocytic infiltrate at dermal epidermal junction, intraepithelial cleavage with acantholysis, non-caseating granuloma, or crypt abscess containing person in discussion who takes drugs, intravenous drugs. He has presentation of jaundice, and on doing liver studies, it is shown that he has HCV RNA and anti-HCV antibody present. AST and ALT are increased. So all of this is positive findings, a finding in this question. Based on this, what is the diagnosis in this patient? What liver condition is he suffering from? Few more responses. So this is how you have to approach a question in exam as well. You have to first so questions in the exam will be 1 or 2 layered, which means that there, or even 3 layered, where you are supposed to make multiple diagnoses to reach the right response. So in this question, we first need to diagnose what is going on with this patient. What liver problem is he suffering from? The diagnosis for this patient is acute hepatitis C. Now tell me that in this question it is written that this patient with acute hepatitis C is also having plaque on a lower leg and oral mucosa. What does that indicate? What is the question trying to tell you? When they say that there are plaque on lower leg and oral mucosa, what does the question want you to think? What condition associated with hepatitis C can produce plaque on lower leg and oral mucosa? So I'll write it down here. Have you heard of lichen planus? This is an important point to remember. Basically, hepatitis C is associated with lichen planus. Actually speaking, hepatitis C is associated with a lot of skin conditions or extrahepatic manifestation. These extrahepatic manifestations are given on in your first aid book in microbiology. You can actually have a look at that. One of such manifestation is lichen planus. Now, what is lichen planus? Basically, I'll make this. So in lichen planus, the patient presents with complaint of plaques on legs or dorsum of wrist, or or there could be some plaques or in the oral mucosa as well, as this patient is complaining. So this is skin condition. This is so in this question, what they're trying to ask you is what is the histology of lichen planus. So there are two important things that you should remember for histology of lichen planus. First of all, the ridges. So basically, this is a biopsy picture of skin, affected skin. So basically, I biopsied the plaque that was present on the patient's, let's say, leg. And what I will see is that these ridges, this reed ridges, will appear saw like this, zigzag. See, saw-like. This is one histological presentation of lichen planus that you should remember. Saw-like retiridges. Apart from that, there will be a band-like lymphocytic infiltrate in the dermis. So basically, all these dot are lymphocytes that have infiltrated the dermis here and even in this picture. So it looks like a band in the dermis, a band of lymphocytes in dermis. So these are the two things that you are supposed to remember as histology of lichen planus. Now, while studying, you might have heard of this mnemonic of 6 P's. So lichen planus is first of all a plaque or papule. It is purplish in color. This color, purple pink in color. Okay. It's polygonal. By polygonal, it means that it's usually shaped like this or this, something like a polygon. It's planar. It means that it has a flat top. So if I try to touch it, the top will be flat, and it's pruritic. It means that it itches. So these are the 6 P's of lichen planus that you're supposed to remember. Now, lichen planus most commonly is found on this part of hand, this part of leg, and on mouth. This is what you have to remember. As seen with our patient, the patient was having these plaques on the leg as well as on mouth inside oral mucosa. It can also be seen on dorsal of wrist. These are the important locations that you should remember. So this is how, and this is all what you should know about lichen planus. So I'll quickly review. Our patient is having hepatitis C, acute hepatitis C due to intravenous drug use. The plaques that are present on his legs and oral mucosa are actually lichen planus. Lichen planus histologically has lymphocytic infiltrate on dermal epidermal mucosa. You have to remember the mnemonic of 6P, and you have to remember where it is commonly seen. Location is going to help you diagnose a lot of skin conditions. So having a good grip over which condition is present over which region is a good thing to know. So there's this one question, does ITP, I suppose you are talking about immune thrombocytopenic purpura. Do they also have purple lesion? Yes, any kind of purpura basically is going to have purplish bluish appearance. But the thing is, they are not, they're patch, they are not plaque or papule. You cannot feel, you cannot basically, they are, first of all, they are not polygonal. How to if you're asking where how to differentiate between ITP and lichen planus, they are not polygonal, they are not pruritic. They are patches, not plaque or papule. Now coming to other options, microabscess with fibrin and neutrophil. This is dermatitis herpetiformis. Intraepithelial cleavage with acantholysis. This is pemphigus vulgaris. Non-caseating granuloma. This is ulcerative colitis. Crypt abscess containing neutrophils. This is Crohn's disease. Non-caseating granuloma, Crohn's disease. Crypt abscess containing neutrophil. This is ulcerative colitis.
Thanks for watching. Please give a thumbs up and subscribe for more.